every American shall have access to quality, affordable health insurance. For more than a century, the special interests have won this moment. Presidents Theodore and Franklin Roosevelt, Truman, Kennedy, Nixon, and Clinton have spoken of our country's aspiration, but only now have we come so far. When the Democrats in the Congress passed Medicare, we lifted seniors out of poverty forever. And now we get to say to working Americans, you can no longer be broken by a health insurance system that drops you when you are sick or lose a job. It says to women, you will no longer be denied coverage on account of a C-section or domestic violence. No longer will maternity or preventive care be ignored. I urge my colleagues.
Also known as Obamacare. The first issue deals with what is referred to as the Anti-Injunction Act. The second issue deals with the constitutionality of the individual mandate, that is Congress telling individual citizens that they must purchase health insurance under penalty of federal law. And the third issue relates to severability, which is if you assume that the individual mandate is held unconstitutional by the Supreme Court, is that severable? Can it be severed out of the rest of the statute? And can the rest of the statute remain in effect as good law? So let me describe each one of those. The Anti-Injunction Act issued.
The constitutionality of Obamacare was called into question because there is a portion of the law that forces Americans to pay a shared responsibility payment for the health insurance. Some states felt this went against the Commerce Clause in the Constitution, claiming that the federal government cannot force people to buy health insurance. The court, however, argued that the mandate could be considered a tax and therefore is constitutional and allowed because of Congress's taxation power.
The next couple of years, and the exchanges are marketplaces that will allow consumers to have a choice of affordable options and also serve as a portal for eligibility and enrollment in public programs and for premium subsidies through tax credits as well. It's critical to realize that exchanges are a mechanism for obtaining coverage, and that is occurring in the context of much more significant changes in the health insurance market. Specifically, there will now be an individual mandate to obtain coverage. And running its own exchange, and those are called state-based exchanges. On the other end of this spectrum, states decide that they really don't want to create their own exchange, and the federal government will come in and do the work of setting up and running the exchange on behalf of the state and its residents. Then there's also a sort of a hybrid model, which is called the state partnership model, whereby the state and the federal government negotiate over what role the state will play and what role the federal government will play.